In this video, you'll be surprised to know that the bridge exercise is not an effective hip exercise. There are two reasons. First, surprisingly, this exercise does not use the hip muscles properly. Second, this exercise does not reflect the pattern we use our glutes in daily life. Let's have a look in details. Number 1. No hip extension. The main functions of glutes are hip extension and external rotation, plus abduction for side hips. So a combination of these movements will generate the most powerful contraction of our hip muscles. However, the bridge exercise starts from the hip flexion position and ends with the hip in a neutral position. So ironically, the hip exercise does not exist in this well-known hip exercise. What would happen if you try to do more hip extension? This will only increase the risk of hip and back pain as your spine has to flex too much. Number 2. No body rotation. In everyday life, we always use our glutes with upper body rotation. For example, when you push off the ground with the left foot behind, your upper body rotates to the right during gait. Then, the left side of your upper body goes forward, which allows the left hip extension. At the same time, your pelvis also moves from left to right, and this will naturally complete the left hip external rotation and abduction. This type of movement happens all the time when you stand and walk around. However, your upper body is fixed in the bridge exercise, so it is hard to do such movement. Number 3. No use of toes. When walking, the toes are the ones that will remain on the ground until the last moment. Take this example again. The more you can push your toes into the ground, the more hip extension occurs as your pelvis gets pushed forward. If you push the ball of your foot instead, less hip extension will occur as your foot takes off the ground earlier. Therefore, you really need to connect your toes to your hip when training. But in the bridge exercise, you cannot put weight on your toes because most of the weight naturally goes on the heels. To sum up, the bridge exercise is not an effective hip exercise as it does not include the main function of the hip muscles. Also, there is no body rotation and toe use that always occurs when using the glutes in our daily activities. Then, what will be a functional hip exercise? Take a look at this movement. The left foot behind is now pushing the ground to drive the body towards the wall. As you can see, the left foot is fully extended with a bit of external rotation as the toes face outwards. So there is a combination of hip extension and external rotation. And then the left toes push into the ground while the upper body rotates to the right side. This type of movement is the most functional hip exercise. This is a basic exercise, but there are plenty of more functional movements in our homepage. So please visit our homepage through the link in the comments section. And I really recommend you to get a full body assessment and then try out our exercises and feel how effective they are. 1. Push your body into the wall using the right foot while pushing your hands against the wall to resist. 2. As you see with my right hand, the toes should slightly rotate outwards as they push into the ground. 3. Exhale through the teeth while pulling the navel in towards the spine and contracting the pelvic floor muscles upwards. 4. Keep the upper body straight and lean the head back slightly to increase the activation in the hip muscles.